While the kids continue working on their mindfulness, I want to find out when we should and shouldn't use infant paracetamol or Calpol. After seeing how its makers have been using marketing that I believe plays on parents' emotions, I've come to the Children's Emergency Department at Leicester Royal Infirmary to get some facts. Consultant paediatrician Dr. Damian Roland deals with sick kids and their anxious parents every day.
Major staff base. Morning, guys.
One of the things parents worry about most is fever.
And he's got a temperature of almost 41, so a really stonking temperature. That really frightens me.
In and of itself, whether it's 38, 39, 40, really that probably doesn't matter much.
But isn't a very high temperature just by itself doing him harm?
No,
Really?
Essentially it's not. It's the body's trying to remove the virus or whatever's causing it.
So let me explain. When children get an infection, one of the things they can do to fight it is to raise their body temperature, because lots of bugs don't grow well at high temperatures, and children's bodies are really good at doing this. They can massively ramp up their body temperature to very high levels for short periods of time, just long enough to zap the bugs. And as a parent watching that child, it can be really frightening, but we don't necessarily want to try and reduce that body temperature using a drug, because we'll be stopping the body doing the thing that it needs to do.
There's still one thing that concerns me, and I'm sure other parents. The risk of fits or convulsions.
But if a child's got a fever and you can reduce that fever with paracetamol, surely that does reduce the risk of a convulsion.
You think so, but it doesn't. So we know from a number of studies that if you're regularly giving paracetamol to stop you getting any temperature at all, the child still probably has a convulsion if they're going to have one anyway.
So a fever itself is not harmful. Treating a high fever with paracetamol will not reduce the risk of seizures, and we should treat the child, not the temperature.
That's exactly it.
If a child is under 3 months old, or their fever has been going on for 5 days, or there are any other symptoms that as a parent you're worried about, you should seek medical advice.